I think what we've seen is that this issue of improving quality and achieving equity, which is the capacity to better identify and address disparities, has really picked up steam in the last 5 to 7 years, particularly because there's been a lot of research that highlights that disparities-related issues really have an impact on quality, safety, and cost. We've seen articles, for example, that show us that minorities are more likely to be readmitted within 30 days with congestive heart failure, more likely to have ambulatory care-sensitive admissions, more likely to have longer lengths of stay than their white counterparts with the same condition, more likely to have tests ordered than their white counterparts, expensive tests such as CT scans and the like. I think that are all important and make us understand the impact of being inattentive to these issues, not only as it relates to quality but also as it relates to cost. I think most importantly what we've seen over the last 2 years is the Joint Commission and the National Quality Forum really stepping to the fore here and developing accreditation measures and standards that are going to really move this issue from what I would say the margin or a luxury to the mainstream or a necessity. At Mass General, in partnership with our Chelsea Community Health Center, we've developed a health coaching program. Coach who's bilingual, who's able to see patients of all stripes and really assist them with understanding the importance of diet, exercise, all the way to medication adherence, and has made a great difference. Certainly, I think that his capacity to speak Spanish in particular has allowed him to engage those populations, Spanish-speaking, whose diabetes was in particularly bad control. And by doing that, he's been able to improve their outcomes, but also improve the outcomes of white patients he sees. And ultimately, by improving quality for all, certainly a wonderful thing. The other major thing he's achieved is decrease the gap between them. So addressing disparities and improving quality in one fell swoop, and that's where we hope the field will go. Hospitals who are interested in this work certainly should begin to consider developing a strategic plan, becoming familiar with the issues. I think that's the first and most important part. But really the foundation of this work is race and ethnicity data collection and patient registration. We need to be able to collect that information. How the patient self-reports their race, ethnicity, their language, because that will then allow us, if we take that data and cross-link it with our quality data, to monitor how we're doing as it relates to the provision of high-quality care. So I think if a hospital is beginning to think about how to move in the space, strategic plan, race, ethnicity, data collection are the first two things they need to engage in. And certainly our Disparities Solutions Center would be pleased to help any hospital in that regard. We have a Disparities Leadership Program that has developed a collaborative of many hospitals across the country who are working towards these ends.